and welcome to the July edition of Talk to Dr. Tiwa series. I am your host and so excited to be here. I apologize for starting late due to technical challenges, but we're here now and we're ready to roll. I am Dr. Tiwa Fisan, a practicing psychiatrist, a physician capacity strategist, a global speaker who is passionate about helping professionals, healthcare professionals, especially physicians, to preserve their most valuable assets, themselves, without losing themselves in doing what they love. I'm excited about the conversation we're going to have today. I have four important guests that I'm looking forward to introduce to you, and we'll get straight in. So if there's anybody that needs to be here, let them know, nudge them that we're live now. And if you're going to be catching up with the replay, also share this link, broadcast it to those that need this conversation. Our topic today is on the power of partnership, support, and purpose. So we'll get started. One of our speakers from May is back with her team. Her name is Adeola Folorunso. Or how about maybe to save time? I'm just going to, while I mention their names, they're just going to introduce themselves briefly and we'll get straight into it. But if you remember May, Adeola was our lovely guest, and we had touched about postpartum depression at that time. She had also mentioned her work, which I'm going to let her remind us about, and what she's done beyond and partnership and with her team. So, Adela, I'll let you start. Remind us, and you're welcome again. We're excited to have you.
Good afternoon, Dr. Tiwa. Good afternoon. It's good to see everyone here again. My name is Adeola Folorunso, founder of Matamental. I carry Matamental everywhere I go, so it's on my head. So yeah, we're here today, not about Matamental, but about an amazing work that I started through the power of partnership. And so, like I said, if I'm not doing mental work, I'm a healthcare professional every day, at the bedside, patient care. That's my day to day activity.
Thank you. Thank you, Adela. So, I have Kehinde Olukayode, the co-founder too of Thryve. Please tell us a little bit about yourself.
Thank you, Dr. Tiwa, for having us. I'm Kehinde. I live in Scotland and I'm a software engineer. I work with an investment bank here in the UK, and my day to day really involves designing and implementing products and solutions that meet the needs of clients of the bank that I work for, and also obviously makes the bank a lot of money. But outside of the work, sometimes I read books, I try to learn new things. Like one of the things I'm trying to learn right now is how to swim. You know, this old stereotype about black people can't swim. I'm trying to I'm trying to break that. And again, I work on Thrive with the other ladies as well.
So great
That's
to
me.
have you. So excited to have you. Thanks for joining us. And
Thank
we
you.
have Dr. Nosarieme Abey. Please tell us about yourself.
Thank you again, Dr. Tiwa, for having us, and it's a pleasure joining you on this live stream. So, I have a background in biochemistry, and I'm a researcher trained neurochemist. And so, what I basically do is let me just touch a bit of my research is more on developmental origin of disease, spanning through neurodevelopment and neurodegenerative diseases, and so trying to understand disease nature at the molecular level. So my day-to-day work will be around working with some clinical data, um, asking questions as a researcher, and a lot of advocacy also as a public health researcher. And outside work, I do a couple of humanitarian services and also trying to find some translational imprint in how I can contribute to my immediate world. Thank you.
That's amazing to hear. Um, and we have Adiola. I need
Hi.
to, yeah, you tell me
Yeah.
your Miss Adiola Ogungbemi. So Welcome. Please tell us about yourself.
Thank you, Dr. Tiwa. And I apologize for the earlier um, delay. My name is Adeola Ogungbemi, and I'm a pharmacist, a specialist mental health pharmacist. And my day to day, okay, I have a background in public health as a public health pharmacist. I've also worked as a trauma pharmacist and community pharmacist. However, right now, currently, I'm working as a mental health pharmacist, and I'm also an independent prescriber pharmacist trainee. So my day to day is providing mental health care basically to my patients as an inpatient pharmacist. So I'm passionate about mental health. Everything spans from anything mental health, from maternal mental health, adult mental health, child mental health, anything mental health is what I do on a daily basis. And I'm happy to be here. Aside from that, I also contribute as little as I can to my immediate environment in creating awareness, public health awareness with regards to other cardiovascular diseases as well.
Thank you so much. Welcome. Welcome, Adela. So, welcome to all of you. I'm excited to even learn more and to discuss more because this is going to be robust, it's going to be valuable, it's going to be enriching. And one of the reasons, to those listening to us, one of the reasons I was so passionate about this topic is, who is in your corner, the power of partnership, support and purposes. Sometimes it can be very overwhelming. You may have an idea, you may have things you're dealing with that you don't, either you're overwhelmed and you don't even know where to start. And, just discussing with Adiola and how Thrive that we're going to get to came to be was really just fascinating and interesting. And I just wanted us to highlight that, discuss that, to even hear your journey to thrive. So, with my first question would be to Adeola Folorunso. Walk me through. How did you meet these wonderful ladies? What happened? Tell us. Walk us through that journey, and then we'll go from there.
Yeah, I think maybe it would be how did I meet them? I actually met everyone through Dr. Nosarieme back last year. We were on a podcast. I believe we were talking about women conversation. Correct me, Dr. Nosar. And then after the podcast, we stayed behind. We got talking, and then the conversation came up about you know, postpartum depression, and everybody had one or two things to say. And then that just brought back the idea in my head that I've been nursing for like 3 years, following mental program in 2023. There was a virtual summit, but after the summit, there were over 250 people there, and there was a lot of emotions going on there. And I just knew that that's not the end of this. There is more to this postpartum depression of a thing. So, but I will let Dr. Nosa come in here to expatiate more on how, the coming in. So over to you, Dr. Nosa.
All right, Dr. Nusa, I'm loving this. So you're a podcast. You host a podcast. Tell us about the podcast and what having these ladies, and here we are. Did you see this happening? What would you say?
Um, Basically, I think she already just more like the brief. So if I'm talking, it would be like telling the stories. If it's going to be helpful anyway. But I had it was the 2025 International Women's Day, and when women get talking, we have some honest discussions. And just as she mentioned, that I host a podcast, and that's a sanity drive podcast, and where I try to bring neuroscience insights closer to people who are able to get some of those filter and be able to imbibe them and make use of those things to inform their behavioral response or daily behaviors. So at the 2025 International Women's Day, I reached out to, before the time, I had reached out to Adeola, the two Adeolas on LinkedIn. And so it was an interesting one. And I will still say that there is still this aspect of for people who may not be very much spiritual, of maybe something divine, kind of, because I had had an earlier plan to reach out to someone who I have looked up to in the tech industry, that is a woman that loved this kind of field, and that was a very big one. And fortunately or fortunately, I was just like, no, I'll go this route. And I reached out to Adeola on LinkedIn. Well, being the researcher, I was able to make some checks, and then I reached out to her, the two Adeolas. And the fact that they applied and they were ready to get on the podcast was something to, and I also had a connection with Kenny. So I reached out through the person I know to Kenny, and then we got into the podcast. And after the podcast, on a norm, I don't usually stay for discussion after the podcast. So the fact that we stayed and we got talking was also something that I think led to some of those things. And then while we were talking about the women's struggle, because it was more of the women neural empowerment, how our neural empowerment help us to make change, even though the world is not really wanting to embrace it, but we've got it and we deliver it. And while we were discussing, we mentioned the ambisewing thing. I'm sure it will resonate with the three of you or the four of you. And then we started talking, and then Dr. Diola, just as she mentioned, chipped that in, and they were like, we should be able to run with this. And we got talking about it. And then after we then followed up, and they were able to then pull things together. So I think just briefly, that's just it was one thing that led to the other. And then it was a sustained conversation after all.
Wow, that's exciting. Thanks for sharing. It's like you said, for those listening, if there's still someone that that is already in your corner, or you wish he or she's in your corner, or you don't know what to do about asking for help, make sure you are tuned in and you're listening, because all your answers may be right here. So based on what I'm hearing so far, and I'm going to let Kehinde and also Adeola to speak, the other Adeola, and it's just like connection, like you said, is just divine. You get a burden, you reach out, and here we are, over a year later. You thought you were just having guests for International Women's Day, not knowing that you were going to it was the beginning of many things to come, many good things to come. So this is I'm excited already. Kende, do you wanna add to how we got here? How Thrive came, and here we are.
I think they've pretty much summed it up. And I think what's interesting for me is the fact that the podcast, I don't think it had anything to do with postpartum depression at all. I don't even remember how we got into that conversation. And I've also never had a baby. So invariably, I probably almost did not have much to contribute to that conversation. But I've also had friends, and I have women in my family that have had kids as well. So I think almost all of us, whether we're men or women, we know people that have gone through similar situations, and we can always contribute like one story or the other to this conversation. And yeah, after that, we just kept in touch, and probably took a while to get things going, but we got there in the end because, this is a great team, a believe,
Yeah.
of people to work with. But yeah, it's been amazing.
That's good. I'm here just smiling. I'm like you rightly said, you just said yes, you came and you didn't know what was ahead of you, and here you are contributing, and this is
Yeah.
this is just amazing to hear. So I'm gonna have Adiola to tell us and why she said yes, and here we are, and then afterwards we'll talk about Thrive, what the work you've done so far. So
Yeah.
Adiola, please tell us.
Um,
Yeah.
I'm just gonna. I think everyone has pretty much said has summed it up. Everyone has said the same thing. But I think for me, when Dr. Nusar reached out to me, it was more like, okay, I'm sure I never I just checked through her profile on LinkedIn. I'm like, okay, this is a cerebral lady here. I would like to join this. And then when we came together as a team, I remember after the podcast, I told my friend, I'm like, okay, I've met cerebral ladies. That was how I put it. And I'm like, you know what? I like to be part of this, even though my day to day is very, very busy. But trust me, these ladies are very good. These ladies in their individual fields, they are brilliant. And I think being part of it was just so, even though it wasn't convenient, but I'm like, I just need to be part of this. And just like everyone said, I can't remember the context of the podcast right now. and how we started the conversation. But I just knew that these ones are the people that they run with things. So each and every one of them, they are a visioneer. And we just said it, and the way everybody carried it, it was very fantastic. I've never seen any one of them. I can only see. I usually only see them online. I don't know where they live. But the way we've partnered together and connected together, everybody has carried it, and it's so amazing because you rarely see those kind of things, especially with people that you don't even know from anywhere.
Yes.
So I would just like to add that these ladies in their individual fields are very, very good. Very good. And that
Wow.
was how we just started, and everyone has run with it. So yeah.
Wow. 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 I'm clapping for the four of you. Like, you are a testament. This common thing where, women don't support each other, women fight, women compete. While that can be true, but this is a testament to when women work together, when women have shared burden, when women have one vision, they run with it. And this is amazing. So I know people that are listening to us now, they're like, what is it? What did they do? What is Thrive? So this is the part that I'm going to let four of you, I would start with, again, maybe Kehinde. I can start with, just Thrive. Tell us about Thrive. You've been the software engineer, the techie, tell us, what with Thrive, why Thrive? What, maybe one of you can tell us why Thrive, and what was it, and how was working on this work. So we've spoken about you came together, why you said yes, and now just walk us through walking through the process, and what was it like for you?
Yeah, from the story we've all just shared, I mean, I think we all understand that, obviously, I think all of us on this podcast right now are from Nigeria, right? And we all know how seriously or unseriously we take the issue of mental health in Nigeria. And, we all live in different countries now. We see how different things are being done outside the country. For example, you could say you have anxiety at work and you get like a week off to just take care of your mental health. That is not a thing in Nigeria. I don't think it was before I left Nigeria. And we all just understood that, if people don't take Thrive seriously, those of us that are a bit maybe more educated about mental health issues need to do something about it. It's like we all have this shared responsibility to create awareness that, you know, there are real issues that women face when it comes to postpartum depression or having babies. And when we were trying to decide the name, I think we just wanted something to signify that you can grow, something that signifies growth or greenness. That's how we came up with the tribe. And if you check the tribe logo, I think it has a green leaf in it that
Yes.
signifies, yeah, something green, something thriving. Yeah, that's how we come up with thrive.
Thank you so much. Yeah, it's for those listening, Thrive is spelled Thryve. And I've gone through the app so far. It's amazing. It's great because, like you said, it gives immediate voice, immediate resource to that mother at that time. Just, now with the power of technology. And that's why I wanted to really just hear your perspective as well, being probably the tech person, but just having that, and having it it's closer than before, where you can
Yeah,
assess, you can, like you mentioned, stigma.
yeah,
Stigma is still huge globally. In
yeah.
Nigeria, is peculiar with the stigma, and so even in
Hmm.
America, it's still there, but definitely not like Nigeria. So it's
Yeah,
amazing what the four of you have created to really
yeah.
just make that woman feel seen. And okay, so
If I may add
Adon,
as well,
yes,
sorry to
please,
cut
yes,
you. I
yes, yes,
think
yes.
another major point for why we went the app direction, because obviously people could just up and go see a doctor or a psychiatrist, but obviously being from Nigeria, most people don't even want to talk about what they're going through. Or if you talk to somebody, you just say you should be happy, you just had a baby or something, right? And you said you've gone through the app. I think we took on anonymous first approach that you can take a screening. And I think we all believe that the first step to getting help is to realize that actually there is a problem. If you understand that what you're feeling, it's normal. Like it's not weird that you're the one going through that. Like most people go through postpartum depression, even if they don't talk about it. Right? So
Right.
we offer this anonymous first approach to getting, screening. If you can screen and see that, okay, the symptoms I'm feeling are actually symptoms of postpartum depression, and that's the first step to getting help. And the app also contains resources, like there are steps that you can go through for to calm yourself immediately if you're feeling anxiety, or if you're having negative thoughts about yourself and your baby, and also resources that can help, like numbers you can call to get help immediately. So I think what I would just like to point out is the fact that you don't even need to register, you don't need to give your details out to be able to get help from the app.
Yes, yes, and I love that. Thank you for highlighting that. That's a great point where your data, nobody's asking for your data, nobody is storing it in that sense. It's really just your own self education. And I like what you mentioned where they are coping the self help tools right away to start
Yeah.
regulating yourself so that at least that gives you some strategies while waiting to see a mental health professional, or maybe never, but at least you are empowered right there. And again, it speaks to we empowering women, you empowering women. It's just very exciting. Okay, so Adeola Folorunso, um with Thryve. Tell us more about it from your own perspective and working on this. What do you have to share about this app, this work, and just being a sequel, a continuum of the mental health summit, that the postpartum mental health summit you had in 2023. What does it feel like, or what should we know about the progress so far?
Yeah, I think to start with, the name of something will determine if people are going to associate themselves to it or not, right? So we never use the word mental because that's a problem. There's already a stigma everywhere. And like I said, from that summit to the word, a friend of mine used the word abisinwi, and I was, as a Yoruba person, it was the first time hearing such, and that name sound very derogatory, and you don't want to attach yourself to such a thing. So we know that for sure, that we don't even want to use the name that has to do with mad, knowing where we are coming from, Africa generally. So that word itself, or the name tribe itself, would not even give anybody clue. It's something that is kind of like anybody can embrace, right? With that. So using that name itself, it was very, very important that we're not stigmatizing and all that. And also, what I do know with this mental health thing, it doesn't have respect for whether you're educated woman, or uneducated, or whether you know what is going on, all that. But what I do know is that people just don't want to talk about. And then for the woman who is educated and who is even financially capable to go see a psychiatrist or to see a healthcare professional, we still realize that they do not go to see, right? That's to tell us that there is a barrier. We want to make sure that there is something that can be as close as possible, that you don't even have to tell even if you feel shy about it, you don't have to tell who is next to you. And that's the initiative about this app, the proximity of you being able to assess yourself immediately,
Correct.
right? And then we all know that when it comes to mental health generally, it's something that everybody's shy about, right? So if you are even saying I'm on Thryve, it's people. You're not already you're not giving people that immediate impression that you're running mad, or you
Mm-hmm.
have the mental health thing going on, right?
Mm-hmm.
Right. So it is just something we're just looking out for, opportunity for proximity, opportunity for people, what people can associate with. So what people that you don't have to be sure about it, and you don't have to. For me, if my team members can remember, I keep mentioning equity. How can even the person in the rural area have
Yeah.
access to things like this?
Correct.
How can it? We
Mm.
want it to be as simple, friendly, easy to use as possible, because we all know that when it comes to mental health, it is not just the rich that is affected. It doesn't have respect
Yeah,
for your geographical
absolutely.
location.
Yeah.
So I would say for now that's where I'll leave it.
Thank you. Thanks for adding that. And yes, what resonated with me from what you said is just that equity. Whether you're rich or you're young or you're old, you're black or white, it doesn't matter. Mental illness is no respecter of anyone. So creating a resource where it will be accessible was very important, and that is very key. And again, it doesn't matter, it doesn't ask your data, it doesn't discriminate, the app doesn't discriminate, which is great. Okay, so I'm going to go now to Adeola Ogungbemi. You being the pharmacist, and it's so great to hear what you do. Mental health. I cannot even imagine how busy you must be if you are affiliated with an inpatient mental health facility. So tell us, what was it like contributing to this, working on this, and again working in this field, like you said, anything mental health. When you're just like this is just good song to my ears, So tell us, doing this, yeah, just bring us into your world while working on this.
Okay, thank you very much, Dr. Tiwa. I think for me, one of the things about Thrive that I would say, one of the driving force is to one, improve awareness of mental health, break barriers, in getting help for with mental health, as well as provide support, for people to get help when they need help with their mental health. So one of the driving forces, like I mentioned, for Thrive is to increase that awareness, and that was one of the things that app is meant to do, because for some reason, especially back home in Nigeria, people struggle with their mental health and don't even realize that they are struggling with their mental health. People don't even know that this is what they are going through, and I think the ability to identify that they have issues with their mental health is the first step, in getting help. Is the first step in getting help towards improving their mental health. And having practiced in Nigeria, and as a Nigerian myself, I'm practicing here in the UK, I've realized that there's so much disparity in how we approach help, or in how we get help for our mental health. People go through stuff here and they are quick to talk about it. Everybody is, oh, I'm feeling anxious. Oh, I think I have, there are so many names for these mental health illnesses: narcissistic behavior, antisocial behavior. There are so many, and people are willing to help. However, looking back to where we are coming from, it's not like that. In fact, the stigmatization that is associated with mental health is so much that people would rather not talk and seek help, And that's one of the driving forces behind the app. The fact that one, people don't even realize that they need help is one thing. Another thing is, even when they realize they need help, how do they go about getting the help? Another thing is that even if they know how to get about the help, what of the stigma? People don't want to be stigmatized. The fact also that people just expect you to snap out of it, which is, I think that's one, people just, in our culture, just like, yeah, strong, we are resilient, you need to snap out of it. You're not the first person that will give birth, it will just go like that. And because we know that mental health is a big factor in our physical health as well, it's very important. If you're not mentally well, you can't be physically well to take care of your child, so it goes beyond the mental health. It even goes into the physical health as well. And I think that's why I'm really passionate about it. Like, as a psychiatrist, with mental health as well, we have other physical health diseases that are very closely related to it. And so if we can, tackle that and tackle it very effectively, it would not only, it would go beyond our mental health and even help the physical health of that woman. And I think that's one of the driving forces for me for doing this, because it's not only about the woman,
Correct.
it's about the baby as well. It's about the other people, the family members. If the woman is well, every other person, she can care for her baby. She can provide for the family. She can be all right 100%. And like I mentioned earlier, practicing here, I've seen the disparity in health seeking behavior, the disparity in provision of healthcare, for mental, for mentally ill patient. I think in Nigeria, what when you hear somebody is struggling with their mental health, the first thing that comes to your mind is the person is running mad, which is
Yes.
usually not the case.
Yeah.
There are
Yeah.
so many things that the person does not necessarily have to run mad. But then I think timely intervention, like we all know, will go a long way in improving the prognosis of the person. So that's one of the things, or that's one of the things that the app is going to do. So we are trying to reduce the barrier between accessing help, identifying the help as well first, and then being able to access support anonymously. So I think I'll just stop it for now.
Oh, that's wonderful. That's wonderful. I'm going to ask Dr. Nusa to speak soon, but I can hear the passion in your voices. And I love it that Thrive, we said yes because we have to be part of it. And um, it's really refreshing to see, creating this app where, like you rightly said, Adela, about the disparity. How can we reduce or remove the barrier? And it's another conversation. It's probably going to be one of the conversation we're going to have, where we can how can we turn a barrier to an opportunity, because the barrier can be very discouraging. And like you said, the stigma, how it's almost like a cultural barrier, cultural problem. Where are you going to start from? It can be very overwhelming, where let's just let the sleeping dog lie. The Nigerians are not speaking up. It's all right, they'll get there one day. It's very easy to say that, but just being, to the four of you coming together, and like you said, Adela, where, here in the Western world, people are more vocal. I mean, they still tell you, though, how are you doing? I'm fine. Some people will still tell fine. Some may not even respond to you. But some may tell you, you know what, I'm tired, I'm sleepy, I'm overwhelmed. In Nigeria, you are fine. Are you okay? I'm fine. The person may then take their life tomorrow, but they are fine. They won't speak up. So I like what you said, which resonated very well with me, that we need to be aware, self-awareness. And then there's a difference between mental health and mental illness. So you don't need to remove clothes in Nigeria. It's until you're on the road removing clothes before people know there's something wrong. We don't have to get to that. That's a spectrum. We It doesn't have to be that bad. Anything that is not making us mentally well, we can start talking about it before it becomes a lot. And another thing I loved about what you said was, to that woman, when you help a woman, oh, you're helping a community.
Good.
When you're helping a woman, you're helping a generation. She can't keep it to herself. Everybody will know. And like you also said, the mood of that woman affects that home a lot, significantly. If she's happy, you can tell. If she is upset, you can also tell. So is she a woman? Most women wear their emotions on their sleeves. So you would know. And it's just, if she can be in tune with herself, you can empower her. She can make a change. So thank you so much for highlighting that. Because while you help that woman, to help a woman is to help a nation. To help a woman, to treat a woman, to help her understand herself, is really to help her, to really make a community, to make a nation understood, to make a nation thrive. So thank you again to the four of you. Dr. Nosa, please tell us what I've heard, neuroscience, I've heard biochemistry. I'm hearing all this, neuroscience. Tell us what's working on Thrive, what it felt like for you. How was it for you doing this project?
Yeah, thank you again, Dr. Tua. So um, I'll just briefly mention, I think the name Thrive even came from while we were trying to form an acronym. And if you, the team could recall when we were talking about how we could get the name, and then we're like, okay, I think there was a time we were looking at maybe transitional help
Mm,
to revive your vitality and emotions. The postpartum period is a transition period. Is a time that a woman has to go through, and then you come out of it. But the experience could make or mar a woman thereafter. And so, I, as a researcher, and sometimes some part of the research that I had, I think, was looking at some environmental cues and how they could imprint, they could place some transposable elements in your DNA that you get to aside the behavioral aspects. And I appreciate Adiola touching on that. The other part, which is at the molecular level, there are some things that get imprint and it's been transferred from one generation to another, and then the child that never knew what experience you had get to pay for it. Get to, I think there is a research that confirms that women, this maternal deprivation has a direct link with depression in later life.
Oh yeah.
So imagine a child that has gone through that just came to the world and he got exposed to this just because the mom had a postpartum depression, which will never announce itself. Which the woman too will be struggling like behind those closed doors, behind the dark room, and there is no one to step in, and that is the gap Thryve came in to fill. Like someone you can speak with, like a relationship you can have with your phone. We interact with our phone, and no one is there it's just a private thing. And you're going through it and you're able to find that solution to what you're going to, you're able to understand. Because the first thing is you understand the space you are, what is really happening. Now, okay, this is maybe these are one or two things that may have been altered, maybe my hormone, and so I'm trying to just get off this thing. And so when you have that clear understanding, it gives the confidence to step ahead. And that is one of the things that Thryve has come in to fill. And as every other person has mentioned, when it comes to the gap that we're feeling, it's not only about the woman, it's also about the community. It's about how well the child is able to, when one is going through postpartum depression, the woman feels no one cares, even when they have that whole support there. And that if there is anyone, I'm using this as an opportunity of a woman that has gone through this or is going through this right now, and you feel there is no other person that cares, think of that child that even chose to come to you. And that's the first person you should even care about. Because as that child has come, you should also, there is a necessity for you to give back to that child, and that is to consult, to get care. And if you're shy and you don't want to hold on to, maybe get to a psychiatrist, or maybe take the whole long trip, as everyone has mentioned, this is an opportunity. Thryve is a private opportunity. You interact with it one on one. You don't even need to give your information out there. And those are some of the things that's motivated me to be here. And as a researcher, looking through, I had a publication in 2025 on the neuroendocrine synchronization that happens, so those underlying mechanisms that happens with postpartum depression, and that was in Springer Nature. And the mechanism is there, it's established. I had a podcast in 2024 for women on postpartum depression, and they talked about their experience, lived experience women. I had someone who was even talking about beating their babies. You can imagine a woman that went through those horrors. I know a couple of women have given birth, and you imagine the woman beating her baby. It's out of her control. It's some deep things that she has gone through, and so society will feel she's weak or she's wicked. No, she isn't. It's just something she's going through at that instance, and this is an opportunity to help come and help out. I think I should leave it that way. Thank you.
Wow, I'm like, Dr. Abe is just, I dropped the mic drop. That's it. Let's all go. Well, thank you so much for that addition where, again, like I said earlier, I could hear the passion why. And thanks for letting us know that even before now, you've had, some previous work in this aspect is something we should talk about. In Nigeria, we don't talk about it as much. To our listeners, if there's still someone that you think should